Hi, I'm Nurse Barb, and this is your daily dose. Today, we're going to talk about something really embarrassing, and that's urinary leakage or urinary incontinence. That's when women have a little bit of leaking when they cough or sneeze or laugh. That's known as stress incontinence. Or there's urge incontinence, where you're putting the key in the door and you just about get to the bathroom, but then your body says, hey, I'm close enough, and we start to leak a little urine. This is very common. If this happens to you, you are not alone, but there's a lot you can do. So 1 in 3 women, 33% of women have some urinary leakage. And for many, it starts after a pregnancy or after delivery. Many other women start to notice this when they're in their 40s or 50s as they start to get into perimenopause or menopause. And that's because as we get older, our estrogen levels start to drop. And estrogen does a couple of things. First, it builds collagen, and collagen is that substance that not only helps prevent wrinkles in our face, but it helps keep muscles very strong. And we have pelvic floor muscles down in our pelvic area. Without estrogen, with less collagen, we don't have the strength in those muscles to stop that urine from leaking. Also, gravity is not our friend. So as we get older, things start to sag. Maybe you've noticed that a little bit in other parts of your body, but things in our pelvis start to move down a little bit. That means the muscles that used to be up higher to control our bladder, well, they're a little bit lower, and so they may not work as well. When women leak urine, it can be very, very embarrassing, and it can limit their lives. Many women avoid going out. They avoid going to book club because they are afraid that someone's going to smell that telltale smell of urine. Many women know where every clean bathroom is in a 10-mile radius of their house because they feel like if they don't get to the bathroom right away, they're going to leak. And that urge incontinence also happens when we put the key in the lock of our door. We've got a lot of groceries in our hands and we're trying to get into the house. Our brain knows we're pretty close to the bathroom. We haven't quite got there yet, but our brain decides, okay, we're close enough. I'm just going to let the urine out. That's called urge incontinence. Another thing that happens a lot is women are trying to get a good night's sleep, and they get up frequently at night, but when they change position, when they stand up, they might start to leak a little bit of urine even before they get to the bathroom. We don't have to live like this. If any of this sounds familiar, again, you're not alone, but there's a lot you can do. First of all, you can do a bladder diary. You can write down how much you drink during the day, when you go to the bathroom, when you leak, and what's going on when you're leaking. Are you jumping on a trampoline or trying to exercise, or is it just getting out of bed or getting up out of a chair? You can also see a healthcare provider and talk about this with someone who's an expert in women's health or someone who's an expert in menopause or pelvic health, like a urologist or a urogynecologist. You can also go online and search how to find a pelvic floor physical therapist. Pelvic floor physical therapy will help with strengthening those muscles and learning how to isolate those pelvic floor muscles and tighten them so that everything doesn't open up and leak urine when you're not ready for it. So let me back up a little bit and talk to you a little bit about why this sometimes happens. We really have to think about our urinary tract kind of like plumbing, right? Kind of like a faucet. So when we squeeze our muscles, we're turning off the faucet, and we should not leak unless we want to, right? Our going to the bathroom and urination should be completely under our own control. So when we decide, okay, we're on the toilet, we're ready to go to the bathroom, we open up that faucet in our brain and we allow urine to flow. But sometimes, right, that faucet opens up without our permission, and that's just not okay. And it's also not okay to buy more pads to soak up any leaks or any urine that might be happening. There's so much that you can do to help retrain your bladder so that you go when you want to. I also have some patients who need medication to help with what we call overactive bladder. And that can help them not have that sense that they have to go so often or that sense of urgency. But if you're having incontinence and it's brand new and you've never had this before, it may be a sign of a bladder infection. Sometimes in early perimenopause, in our 40s and early 50s, all of a sudden we may start leaking right out of the blue. And sometimes that's because we have a little bladder infection because, again, those estrogen levels are dropping, everything is changing in our pelvic area, and we may have a little bladder infection. That's very easily treated. My take-home message for today, though, is if you are having leaking, don't just put up with it. There's so much that can be done, and most of it is super, super easy, and it doesn't require surgery. Most of the time, it doesn't even require medication. Sometimes all it takes is being taught how to do those pelvic floor exercises. You might have heard of them in the past as Kegel exercises. Sometimes it just helps to know how to do them properly, get on a routine of doing them regularly, and sometimes 30 a day is all you need for a couple of weeks to get drier or even become 100% dry. I hope this helps answer your questions about incontinence and leaking. If you like this video, please click on like and subscribe. You can also go to my blog, nursebarb.com, and I just started a new menopause-based website called yourmenocoach.com with lots more information on everything related to menopause, including how to deal with incontinence. So I hope this has helped. Take care and be well.